Our top story, political leaders are promising that mass vaccination campaigns will see life returning to normal as more contagious variant of coronavirus spreads across dozens of countries, adding urgency to the race to end the pandemic. But vaccination efforts are rolling out slower than promised, raising doubts about an imminent way out of this crisis. William A. Haseltine, a scientist, business author and philanthropist, wrote an article about how there will be no quick fix for COVID and how the main ways to tackle a pandemic, leadership, governance and social solidarity, that most countries have failed on all these three accounts. Mr. Haseltine now joins us to talk more about his assessment of the pandemic and the situation in most countries. Sir, you wrote about how there would be no quick fix for COVID and that the main components of controlling a pandemic. If you could elaborate on that.
Well, the main control of the pandemic has been clear for quite some time. It's public health. Some countries, China in particular, has done an excellent job of controlling a major epidemic in their country through public health measures alone, identifying cases, identifying contacts, people exposed, having a mandatory quarantine for those exposed, whether it's an entire apartment building, an entire section of a city, an entire city or province. And they've managed to keep the infection rate extremely low despite a very big initial infection. The only problem is the rest of the world is rampant with COVID. And so their problem is trying to keep the virus out of their country from import of goods and travel from people. We've got very good evidence that it can be controlled. Unfortunately, that's not the case in the rest of the world. The rest of the world is suffering from very serious pandemic. India, Europe, both North and South America. In fact, almost the entire world except some small nations and China. The rest of the world that is now affected by this pandemic is doing their best to develop vaccines to prevent this virus from spreading further. Those vaccines, and there are many of them developed by a number of nations, including India, are likely to be effective for the first wave. They've shown some remarkable efficiencies in the very first tests of some of the newer vaccines and some very good efficiencies for others. The issue is with a virus like this, we're already beginning to see resistance. We're beginning to see change in people who are infected for a long period of time. We're beginning to see strains that spread more easily. And if you look at them carefully, some of those strains are already resistant to many of the natural antibodies that people make. There are one or two strains in particular that look as if they'll be resistant to most vaccines. There's a mutation in a virus that comes from South Africa that's spreading rapidly, and another one in Brazil, which decrease the ability of the body to neutralize it by about tenfold. That's a very serious consequence. I think that the long-term consequence of this pandemic is likely to be to create not only a pandemic, but an endemic, a infection very much like the flu that comes back and persists and changes. That doesn't mean it's hopeless. That doesn't mean we're going to suffer from this kind of situation forever. But it does mean we have to be vigilant. We have to not assume that we're going to control the pandemic in any near term. We're not going to assume that any vaccine will work forever. We're not going to assume that any drug that we develop will work forever. We have to be continually vigilant and continually applying our very best scientific and medical efforts, as well as public health efforts, to control this pandemic.
Now, you spoke about the need for leadership and social solidarity. If you could, elaborate more about that, especially how you feel countries have done.
Well, one thing that's clear in an epidemic is you need leadership, you need credibility, and you need consistency in communication. Because to get an entire people to adopt reasonable public health standards in times of pandemic, you need really good foresight. And I think that's what the Chinese showed above all. After the initial fumbles, which were serious, they took it on in a very systematic way. The leadership made clear what the problem was. They had a credible leadership that the country believed, and they had social solidarity. Now, in the U.S., we had almost the opposite. We had a leadership which was incompetent, which denied the existence of the pandemic, which did everything they could to encourage people not to adopt the safety measures that were necessary. So we had leadership that wasn't farsighted, that wasn't credible, that wasn't consistent. And in addition to that, you need good governance. Now, you can have good leadership, but not good governance. I would say India is a country that has lacked good governance in the ability to execute some of the plans. India is a really big country, as you know. Mm-hmm. It's actually like many countries. The different provinces and are very different from one another. And so you've had trouble having a governance issue in India, and the infection has spread. Fortunately, the infection has calmed down somewhat, but it's still a very serious situation there. Europe, you've had a mixture. Sometimes you've had good leaders. Sometimes you've had indifferent leaders. Sometimes you've had great governance. And I think it was a big surprise to how the Europeans first controlled it, then let it loose, then it exploded again, and now it's out of control, and they're doing their best to control it again. So I think you've got a situation with a pandemic that's global. Different countries around the world respond differently. There's some particularly bad examples. The U.S. is a terrible example. Russia has been a terrible example. Brazil has been a horrendous example. And India has been an indifferent, I would say, mediocre to poor example.
All right. And what are your worries about the more virulent variant that has spread in England, and it's being reported in the U.S. as well in several states there? Then you have the South Africa variant, and now reports from Japan as well.
Well, the strains that are coming up should be expected. Viruses are expert code crackers. They have their own equivalent of machine intelligence. They throw many, many random changes at a problem, and the ones that work are the ones that proliferate. So what we've seen in the first phase of the disease is a totally naive population with no defense, and the virus just grew very readily. There was no reason for it to change. But over time, we've learned to use convalescent serum. The virus encounters people who've already been infected. The virus will encounter people who've been vaccinated. And some of the changes that the virus makes, and I've counted there are probably 10 to the 22nd changes this virus has already made in the human population. That is an enormous number. That is 10,000 quintillion changes. And there may be more in the whole population of viruses that are out there. That the viruses will find ways around our natural immune defenses and around our vaccines. And it isn't that there's one UK strain or one South African strain or one Brazilian strain. There will be many strains. The more we look, the more we'll find. It's like the flu. The flu changes in several different ways. It does mutation. It does recombination. It does many tricks to get around it. And we ping pong from flu seasons from the north to the south. And in the temperate tropical regions, it's continual. And that's what I think we're going to be looking at with the COVID. We can control it. We can limit it, but it's very unlikely we'll eliminate it. Let me point out something else that most people don't comment on. This virus is moving endemic into our domestic animals. We've seen the infection in mink, but it's in dogs, it's in cats, it's in monkeys. It's going to be in all the animals that surround us. And it will go ping-ponging back and forth, just like flu does, between pigs and birds, some of the wild birds, some domestic birds, domestic pigs. We're going to be living with this virus probably for decades to come, if not longer. We've got to put a long-term systematic effort, just like we do with the flu, to make vaccines and, I would argue, much better drugs and improve our global public health standards everywhere.
All right, very concerning points that you've raised there. If we talk about the vaccine process in the United States, it's been alarmingly slow. It's been very, very surprising watching it from here in India. What kind of obstacles have there been that have made it so slow? And, here in India, we're waiting for the vaccination to begin on Saturday.
Right. It comes back to the three central elements: governance, leadership, governance, and social solidarity. The leadership has pushed as its sole effort vaccines, which aren't the best way to control the disease. The best way is public health, followed by vaccines and drugs. So that's the first problem. Second problem is a structural problem. It's a governance problem, one that is a serious problem in India as well, which is the relationship between the central government and the provincial or the state governments. In the United States, as in India, the central government can give money, can give instructions, but the implementation is largely a matter of the states. And the United States is even more complicated. We call it by jurisdiction. A jurisdiction may be a state or a province, or it may be a district, or it may be a township, or it may be a municipality. And there's great confusion in the United States as to who has authority to determine who gets the vaccine, when they get the vaccine, and how they're going to get the vaccine. In addition to that, there are very limited resources that states have. They don't have the power to go into debt. Only the federal government can go into debt. So they don't actually have the money to provide the new people, the training, the facilities to get these vaccines out. And the central government in the United States can only recommend and suggest what should be done. That leads to one town maybe having a different policy from another, and it's actually happening. So some people say, oh, we're going to take care of the people in elder care homes first. Other states say we're going to do it to healthcare workers first. Others say some rich people can get it just by paying more. I mean, it is a mess. And I suspect India is going to experience the same kind of mess. I would warn people not to try to skip the lines. There are scams out there that make fake vaccines. Is that a surprise? No. People make fake everything. In fact, they make fake nylon stockings. They make fake everything. Why shouldn't they make fake vaccines and fake anti-COVID drugs? Of course they will. So stay in the lane, get the approved vaccines from the authorized distributor, and don't try to go to a black market or skip the line.
All right, stay in the lane. Important point there for India. And finally, will you be able to hazard a guess as to when we can expect things to perhaps return to normal?
Well, it depends where in the world you are. In China, it's already over. They still have to put out fires. But I think for the United States, it may be summer 2022. For much of the rest of the world, India included, it'll probably be summer 2024. It's going to be a slow slide into something like normalcy. But we're going to have to make sure that we are more vigilant about infectious diseases than we have before. And the other thing I'd like to point out is that this virus has selected poor governance. It shined a light on poor governance around the world. And the increased death and destruction of economies and lives that we see as a consequence of poor government is not just about COVID-19. It's about many other aspects of life, other healthcare situations. So in those countries that generally have complicated and difficult governance issues, you have serious COVID and you have serious health issues. You have serious economic issues. I think this is a lesson for the world. Improve leadership, improve governance, and improve social solidarity. Not just for COVID, but for all problems.
All right, sir, thank you so much for sparing your time and speaking to us here at NDTV. Now, let's focus on India. And India aims to begin its vaccination program of $1.3 billion people against coronavirus from Saturday. It's going to be a colossal and complex task in one of the world's biggest rollouts anywhere in the world. India is the second most populous nation, and it hopes to inoculate 30 crore people, equal almost to the entire US population by July. Now, the first to get one of the two vaccines granted emergency approval will be 3 crore health and other frontline workers, then followed by around 27 crore people aged over 50 or deemed high risk all over the nation. So many of you out there have many questions. We're going to try and answer many of them. Not me, of course. We're joined now by Dr. Sunila Garg, Director and Professor Community Medicine, Maulana Azad Medical College, and someone who's a member of the Delhi COVID Task Force. Thank you so much, ma'am, for joining us on the show. And let's just dive in. That vaccination program is all set to begin on Saturday. Many people have many questions. Let's just listen into the first one.
Good morning, doctor. My name is Pooja Biduri. How do I ensure my parents get the vaccine quickly when the roll out begins?
So she wants to know, doctor, how to ensure her parents get the vaccine quickly or they're there in line. I think this is something that's concerning many people.
Yeah, number one is that basically if her parents are healthcare workers, they will be automatically enrolled, number one. Number two is that if the parents are elderly, that means more than 50 years of age, so they will get the number second. That means first will be taken into consideration our healthcare workers, frontline workers, and which will be then subsequently followed by the people who are there above 50 years of age. So in the second run, when we are talking of people who are 50 years of age, we will be going through the electoral poll, and it will be around that time we'll be having our CoWIN platform, which will be thrown open to the people. That means they can download the app. But I will also tell people at this juncture that beware of the fake apps. You must be downloading the real app and make sure that your parents' name is there or not. Otherwise, you can make an entry over there, and according to the time, they will get that. And by and large, we hope that everybody amongst these 30 crore individuals, they get vaccinated by July.
All right. So we're aiming to have a 30 crore vaccinated by July. We have another tweet question sent in to us. Vaibhav has asked a question. Can we choose between the two vaccines?
We cannot choose between the two vaccines because we have, looked at both the vaccines very carefully, which are equally, safe, equally immunogenic, and, they are having good efficacy. So, vaccine will be coming district-wise. And one thing which one has to keep in mind, if one time you get Covishield, the second time also you will get Covishield vaccine, and which will be insured through CoWIN app. So our standard operating procedure manual is quite very good, and it is very standardized to make sure that everything happens in place. And that's how we had approximately 3 dry runs in quite a number of places to make sure that we do not, kind of miss out on these things. So we are very sure about both of these vaccines, safety, efficacy part. So there should be no worry and there should be no vaccine hesitancy, as I were to bring to everybody's attention.
Absolutely, ma'am. Let's just listen in to the next question.
Even after the vaccine, people will have to follow all precautions. Why is that?
Right. So this is something that has been said that even after you get the vaccine, you must, continue with, mass social distancing, and that people have questions about that.
Yeah. See, one thing is that before the vaccine, after the vaccine, we have to carry on with the COVID appropriate behavior for quite some time till, we achieve the herd immunity and we wean off from the virus, from the country setup itself. We should wait for a stage till we become have an endemic kind of a situation. But COVID appropriate behavior, I think it's one of the very important things which will prevent us from so many other things also. Now, if you will see, like whether we are talking of, the episodes of acute respiratory infections, or we are talking of asthmas or bronchitis and all, they're also much less if people are wearing masks and all that. Much lesser number of acute respiratory infections. And also we have focused a lot on hand washing and, sanitization and maintaining distances, which also saves us from other problems. So COVID appropriate behavior has to be followed in for quite some time, and we should be very sure that we are having, much lesser burden of the disease. And till that time, people have to follow that. And I'm sure people are, by now they're used to it and they are not fed up of this behavior. So this has to be inculcated as part of the lifestyle.
All right. So this COVID-appropriate behavior, this pandemic behavior that we've all been practicing is something that we need to continue even after the vaccination begins. Thank you so much, Dr. Sunila Garg, for joining us and answering all those questions for us. With that, time for us to slip into a short break. On the other side, we'll bring you stories from around the world. Stay with us.